A round of applause for you. We're now going into the Partners and Leaders Forum. All right, a warm welcome to you from Teach to Reach. 10 health workers share experience on the front lines of climate change and health. Many other topics today at Teach to Reach. Let's check where we are in our program, in our schedule. We're now going into what we call the Leaders and Partners Forum, and this is the very first time we are doing it, championing community-driven learning and action. If you want to see who these partners and leaders are, you can go to the conference website and you can see here we have amongst our global partners UNICEF, NPHCDA for the UNICEF Nigeria Immunization Collaborative, which we'll be introducing in a few minutes. DevX is one of our media partners. I'll also introduce the Gavi Vaccines Work website. You can see a series of articles on Gavi's website about Teach to Reach and really drawing upon the experiences of Teach to Reach participants across a range of topics. We also have the Health Policy Watch as our third media partner. So this is for independent global health reporting, and you'll see that they are featuring Teach to Reach and encouraging global health partners, global health staff at all levels to join Teach to Reach today. So these are some of the global partners together with the Zero Dose Learning Hub, of which the Geneva Learning Foundation is part. And then it gets very interesting. We have a range of partners whose logos you can see here. And the first thing we want to say is to welcome each and every one to the Teach to Reach family. We'll be hearing live from them. If you do not know these any one of these logos, I encourage you to go to the Teach to Reach website, check them out. If they have a website, the website is linked, and I especially want to thank Maria Manzan, who's coordinating all of these global partners. We're then going to go, so these are the partners that are being featured with their logos, but there is a much larger list, and that is where I want to really take the time to go through. So here we go. All right. So we welcome all these partners to Teach to Reach, and we are going to go through the full list of all of the organizations whose leaders came to Teach to Reach. Some of you for the very first time, not knowing who we were or what we do. Over the last few months, we got to know each other. And today, we're very pleased and proud to welcome you to the Teach to Reach family and to share with you this moment before we turn to those of you who are in the room. If you are a leader of an organization that has become a Teach to Reach partner, please raise your hand so that Charlotte and Maria can identify you. Here we go. These are organizations from all over Africa, Asia, Latin America, Francophone and Anglophone countries. We warmly welcome you to the Teach to Reach family, and we hope that you'll find the experience you have here at Teach to Reach useful to the work of your organizations, and you'll be able to contribute and benefit from it as well. We want to highlight partners eHealth Africa and EHA Clinics, with whom you'll be joining. You'll be invited to join a plenary session and then 2 workshops on really empowering health and empowering communities with data-driven local solutions. We've already had the pleasure of meeting David Akpan, and many of you came to his lightning chat. We also are proud to count amongst our partners uniting to combat neglected tropical diseases. There we had the pleasure of meeting Toko Elfik Puli, who's the Chief Executive Officer, to discuss the relationship between climate change and neglected tropical diseases. So, as you know, Teach to Reach has grown over the last few years, and I'm going to show you exactly how much. So, Teach to Reach 12,398 participants. Those of you who've been here since Teach to Reach 6 know we do this every time. Teach to Reach 7, 13,676. Teach to Reach 8, 16,835. Teach to Reach 9, 17,662. And we have the final number for Teach to Reach 10, even though there'll probably be some people joining throughout the day. But as of this morning, believe it or not, there are 21,398 health professionals registered for Teach to Reach 10. Let's go check in, and I want really to thank the organizations that have joined Teach to Reach. Let's go check in on the plenary here. Veronica from Kenya, who's not a medic but founder of a patient support organization. I believe, Veronica, you are amongst the leaders that we're welcoming to the Teach to Reach family today. Now, I'm going to turn to Maria, who's been coordinating these amazing partners and leaders, and we have a number of raised hands in the room. Who shall we hear from first? We have a question for you as a leader. We want to avoid really just hearing you. We're sure you'd like to speak about what your organization, but we have two questions for you. One is, how many people are attending Teach to Reach from your organization? Whoops, let me just fix that. And a second question, why did you become a Teach to Reach partner? Maria, over to you. Who shall we hear from first?
Thank you, Rita. Chica Offer, I think you're unmuted already. Go ahead. Don't forget to introduce yourself.
Yes. Teach to Reach. We are the pioneer. We started together. My name is Chica Offer. Can you hear me?
Loud and clear, Chica. A warm welcome to you.
Can you hear me? Okay, my name is Chika Ofo. I'm the CEO of Vaccine Network for Disease Control, and I'm happy to say I was here from the very beginning. I am so excited with the numbers. Oh my God. And one of the major reasons that supported me being a partner was I learned a lot. I met many people and I had many ideas, and I learned many ideas. And some of the ideas I'm using today in my organization. And guess what? We are flying. It's so inspiring. Teach to Reach. It's really teaching to reach. And then now I know the world is a global village, truthfully, and it's practical, because now I see people from different countries. I'm so excited. I can't stop talking. I feel like jumping. Rada, thank you so much for giving me this opportunity. I don't take it for granted. I've met so many people. I've learned so many things. And oh my God, I became a partner because there's so much to learn. There's so much to give. There's so much networking. There's so many people we have come into contact with. We know the latest trends. We know what is happening. We know where to put our focus. We know how to align what we do with what is happening globally. So I just want to say thank you. And my organization, about 3 people are from my organization that are attending, that registered for Teach to Reach as well. Thank
Wonderful,
you so
Chica.
much.
Thank you so much.
Grateful to be here.
Great for you to be back. Maria, I'm secretly hoping the next person is joining Teach to Reach for the first time, but whether or not that's the case, we can't wait to hear who's going to tell us next. We're listening to leaders and partners. Over 220 organizations have become Teach to Reach partners. Maria, who are we hearing from next?
Thank you, Rita. Justin Espoir Machongo, I am asking you to unmute. If you can do so you can introduce yourself. Welcome.
Okay, thank you very much for the opportunity. My name is Justin Espoir Machongo. I'm the CEO of a UK-based charity called Stand as One. Stand as One is a non-profit organization working for the advancement of education and community development. We recently ran a project of education program on climate change and environmental crisis in Burundi. I'm so excited to be here today. Thank you very much.
Okay, wonderful, Justin. So how many people are attending from your organization, and why did you become a Teach to Reach partner?
three people have attended this so far, myself and the other two. And we were inspired because we saw this online, and then we said, okay, let's join it straight away to meet other people and make connections. Thank you.
All right, wonderful, Justin. Thank you, and welcome to all three members of your organization. Maria, who's next? I saw that Prajakta Pradeep had, Prajakta Pradeep
I'm
Shukla.
asking.
Yeah, would you like to
hi.
introduce yourself and tell us, introduce your organization, tell us why you became a Teach to Reach partner and how many people are attending today from your organization. You saw the reason we showed the numbers is you can see that there's more than almost 4,000 new people who have joined today's Teach to Reach compared to the last one that was held in October 2023. So that's quite a leap. We'd love to hear from you, Prajakta.
Hi, thank you for having me over here. It's a wonderful platform. I just got to know about it from one of the colleague, and the idea of connecting with the people who are actually working on the ground level, who have their own difficulties and issues. It's so inspiring, and I'm very thankful for the Geneva Learning Foundation for bringing all this on one platform. And I'm sure this is a very tough task. So good job to you guys.
All right.
I work with. This is a marvelous, magnificent task that you guys are doing.
Thank
So,
you, Prajakta. So my next question for you is then, what are your expectations? What are you hoping to learn by sharing your experience with people who are on the ground in local communities from all over the world and who are connecting today through Teach to Reach?
My expectation is to know more and more about their experiences, their challenges, and how they're overcoming those obstacles. We might be between different landscapes, different countries, but I'm sure as an individual, we are facing the same issues and a big barrier that is the climate change. And it's not the easy journey, but it's good to know that so many people are together in this.
All right. And one last question for you. In your community, remind us where you are exactly. What's the biggest challenge that you face, and how does your organization actually help?
Right. So I'm based in Delhi, and my organization is called Institute of Grassroots Governance. We work with panchayats. Panchayats is a grassroots organization, the administrative units who help people, who help the administrators to understand what's happening and how to deal with it. So we are at a very conceptualized stage. We are still designing the programs, but at this point of time, we are trying to aware people. For example, now in Delhi, the heat waves are at the height. We are having temperatures of 52 degrees Celsius, and so many people are getting sick. And they don't even know that it's because of the heat waves. They just feel that they're getting sick because of, dehydrating or something. I mean, they don't have the understanding. So our job is to intervene and tell them that it's a heat wave, don't step out. If you get sick, drink a lot of, salts and water and keep yourself hydrated. So we are just at the awareness stage, but we look forward to conceptualize and design proper programs.
Very interesting, Prajakta. Did you answer any of the Teach to Reach questions, or did members of your organization do so as well?
From my organization, I'm the only one who look forward to the health vertical. So yeah, it's only me, but in the future, there'll be more people to join from our organization.
Okay. All right, thank you very much indeed. We're meeting some of the leaders and partners. You can see the amazing list by going to the reception on the Teach to Reach website. You can see here. So it's called sponsors, but it's actually partners and sponsors. And you can see the organizations that shared logos and met all the specifications and requirements that Maria Monzon, our partnerships coordinator, had for them are up on the website. If your logo and your organization did not make it this time, you are still a Teach to Reach partner, and we value you as a valued member of the family, and you can be there for Teach to Reach 11, but there's already a very impressive number of organizations here. All right, wonderful. Maria, I'm turning back to you just to hear this time.
Thank you very much.
Yeah.
Sorry?
Go ahead. Who shall we hear from next?
I was gonna ask Farm Bernard Baju to introduce himself. Welcome. I see you're unmuted.
All right, just before Farm Bernard comes back to tell us more, Ali Cisse from Mali, who's a doctor for emergency medical help and humanitarian assistance, says he wants to speak now. He's connecting from YouTube, or he's on the stage in our conference platform. So in that case, let me see. Yeah. So in that case, you can share your comments and questions on YouTube or wherever you may be. We'll be able to bring them in. For example, here is a comment from Adaemo Sunday Charles, who just says hello. He's from Niger. Back to you, Maria.
Thank you. Farm, if you cannot unmute, I'm asking Ulu Felique. Can you unmute? We're having connection issues. Or Justin,
Hello?
it's what? There you go. Go ahead.
Hello?
Please introduce yourself. Yes, we can hear you. Welcome.
Great. Thank you very much. So my name is Farm Bernard Bedu Bediakon. I am the District Director of Health Services of the Ghana Health Service, Amaste West District Health Directorate. And I'm really happy to be part of Teach to Reach 10. I have been a part of Teach to Reach since its inception, and I could recollect.
Did we just lose?
I think we
Farm
lost
Bernard?
you.
Okay, I'm so sorry. And Farm
That
Bernard.
Reach 5, I was a speaker on COVID-19 vaccine integrated into our routine immunization sessions. And so for me, Teach to Reach has been very, very helpful to me. A lot of great ideas as to how we could ensure zero-dose children in the reaching out to the zero-dose, making sure that every child within the district receives full immunization. And through the networking, I got new ideas from other countries, how they are doing it. And it has really helped us in Amaste West District. And so our immunization coverages are always above 100%. And that has been very, very helpful and remarkable to us as a district.
Thank you very much indeed, Farm Bernard. And I want to highlight that actually there's a very strong presence today from the Ghana Health Service. A number of regional and district level branches of Ghana Health Service have joined. And we recognize when we speak about local organizations that in many cases it is the government services, the government health services that are based in a community. Your mission is to serve community needs. And it's led by community members and it's accountable to the community served. So in our call for local partners, we realize that there's something very powerful, a kind of alliance between the civil society organizations where people just out of goodwill come together around a specific purpose or mission, and the government whose responsibility it is to respond to health and other needs. Just to clarify for Bwango Benjamin Mukapa, who says he has no option to unmute. So you're in our Zoom studio. You can. We asked you to raise your hand and also type your comment in the chat first, and then we'll come to you. Yes,
his
go ahead,
hand is
Charlotte.
now raised and he is on. I just wanted to say his hand is now raised and he's unmuted.
Okay, and I believe we've heard from Bwango Benjamin before in the lightning chat. So yeah, go ahead, Bwango. Why did you become a Teach to Reach partner, and how many people are attending from your organization?
Thank you so much for such a good question. Good morning to everyone. By names of Benjamin Mukapa, logging in from Uganda. I'm the CEO of Villa Research Aid Initiative. Actually, 4 of my people from the organization have joined this session. It is a very good session and I welcome all the collegians. I think there are several reasons as to why Villa wish to become partners with the Reach to Reach 10. First of all is knowledge sharing. By working together, the 2 organizations could share knowledge, data, insights that benefits both of our efforts. This combination of the ideas and information could be led to the new breathing thoughts. I think next I can talk about is increased impact, combining the Teach to Reach connections and reputations for both organizations could amplify the impacts they are able to have on improving health through education and other initiatives. Maybe to add on, I can talk about expertise in research and innovation. At the Village Search Aid Initiative, Kilekila has expertise connecting research, developing new technologies and approaches, and identifying innovation solutions. This could be valuable for Teach to Reach, and as we all work together to address health-related challenges. That's all I can talk about why to become a partner, Teach to Reach.
Thank you very much indeed. All right, many messages coming in our Zoom studio and also across social media. For example, Joanne Kainiu is a nurse and has been participating in immunization services Teach to Reach. She's not a partner, but she says she's gained hugely in reaching every child in the community. Beatrice Micah Layope, Faces Nigeria, is that the name of your organization? Can you clarify? Hamida Mohammed Yaldu says good morning. Hamida, are you involved in in an organization that is a Teach to Reach partner? Let us know. And of course, for organizations, this is an amazing opportunity to connect with partners from all over the world. Back to Maria for our next leader of an organization that has become for the very first time a Teach to Reach partner.
Thank you very much, Rita. I want to invite Fatima Sarah Abubakar Otaru to introduce herself and to tell us about her organization. Fatima, the floor is yours.
Can you hear me?
Loud and clear.
Yes, we can.
Good morning, everyone. Good afternoon, good evening, hello from wherever we all are. My name is Mrs. Fatima Zara Abubakar Otaru. I'm a public health professional, a public health educator, and a senior lecturer at the College of Health Technology in Bauchi State.
All right. And so the question for you, of course, is why did your organization become a Teach to Reach partner?
Well, I've registered I registered to be a member of Teach to Reach since 2020. In fact, I looked through my email and I realized my first mail officially was in December 2020. And I so appreciate Teach to Reach for never giving up on me because for every mail that was sent probably to everyone that has ever registered, I received every single one. But obviously, things have been busy one way or the other, and I've never really had the opportunity to participate fully. It's either I will participate, I will listen to come on the meeting once and never attend again. And that's how it's always been. But this year, based on developing in my career field and everything, I was so passionate and so interested in participating in it fully to see, and all the things that, to also reiterate everything that has been said, like all the messages to learn from Teach to Reach, I've always been following it, which has really improved my career field too. It's just I've never physically participated or even ever spoken, yes.
And Fatima, you are part of a university. Are there other, do you have colleagues and students who are joining?
A College of Health Technology, not university.
Okay, College of Health Technology, yes. And so do you have colleagues and students who are participating today?
Yeah, I sent the invitation to most of my colleagues, which I'm not certain if they registered, but I am practically the representative of the institution. Yes, I am the representative of the institution to participate.
Wonderful.
Yes.
All right. So a warm welcome to you, to the Teach to Reach family. Again, we're honoring what we call local organizations that are based in a community, that are serving a community. That is the mission, that are led by community members, accountable to the community served. And at Teach to Reach, we recognize and welcome organizations that are private, such as non-governmental organizations or civil society organizations, as well as public, local government, health services in particular, have very strongly been participants in Teach to Reach since the beginning. Today is the 10th edition and continue to be an important source of health and support for local communities everywhere. So once again, thank you. We have time maybe for one or two more people. Maria has been the one engaging with all of these new and old partners. Who shall we hear from? Perhaps our last speaker today.
Thank you, Rita, and forgive me for my pronunciation, but let's listen to Mohairwe Ronald Sion, who's already unmuted. Go ahead, and please don't forget to introduce yourself.
Yes, good morning from Uganda. I'm called Ronald Mohairwe Zion, the Director of Association for Promotion of Sustainable Education Services in Uganda. This is my first time to happen or to be in Teach to Reach 10. I'm so happy. Our members are so happy. Currently, 3 members of my organization are already in the session. There are 3 of them who are already who are already attending right now. The biggest challenge that we have faced in the community is about the information dissemination. Like, for example, yesterday we got some challenge whereby there is a breakout of polio in a district in eastern Uganda called Mbale. So my organization helped in through teaching the girls, disseminating the information to the community, more especially in the lower and hard to reach areas.
Understood. Thank you, Mohari Ronald Zion. And I take note of a very strong presence of Ugandan health professionals and partners in today's in this Teach to Reach, as well as in the responses to the Teach to Reach questions. We thank and honor health professionals who share with their colleagues and the organizations again who share with their networks. As you can see, this number is quite eloquent, and we attribute it to you as organizations that have joined the Teach to Reach family as partners. We're really in Teach to Reach 9. This was in October 2023. Some people think it's an annual event, but it's actually several times a year. And last time, 17,662 health professionals. And this time you heard this number, but it's worth showing again. You are 21,398 strong, including more than 12,000 Anglophones registered for Teach to Reach today. Of course, we know that many of you won't make it due to connectivity and other issues, but there are many ways to catch up and many ways to keep going. So we're 3 minutes away. I see many in our Zoom studio, many hands raised. We're going to go into the opening ceremony. Perhaps, Maria, we'll have time to hear from one more partner, one more organization. Do share your messages. I'm just going to go and look at the stage, which is where most Teach to Reach participants are. We have just to recognize and acknowledge some of the messages from Evans Juta, Henry Bach, Patience Adeda, Thulisile Mazia, from Eswatini, Dr. Abubakar Jafar Usman, who's hoping for fruitful deliberations. Umar Garba, Chipo Sitambile, Guaya, who says, hello, everyone. Chipo, don't just say hello. You can tell us more. Tell us who you are, why you're here, what you're expecting from Teach to Reach. Patience is sorry that she hasn't been a part due to many official assignments. She's right now in transit, but you're still managing to connect. That's wonderful. Patience Anumu, Tito Gomez, Wande Manegde Sawadogo, and Husseini Garba, Rina Day. I'll stop here. Back to you, Maria, for maybe one last. We have just 2 minutes before going into the opening ceremony.
Thank you, Rita. Justine Namuli, you're already unmuted. Go ahead. You have a minute or two to introduce yourself and your organization. Justine.
Hello, everyone. My name is Namuli Justin. I am from Uganda. I am the CEO of Jasen Health Ventures. I am a public health specialist. I am a regional coordinator for the Uganda Youth Coalition for SDGs, which is an umbrella organization for all youth-led organizations in Uganda. And I'm also a social entrepreneur within the health perspective. I became a Teach to Reach partner because of the main reason was this is a quite unique platform that I've not seen before, that recognizes small organization, recognizes the work of people, even community health workers, which is so rare to find. We usually have seminars that are on global level. We do not really get to understand what people are doing in the community. And I could credit you for that. Thank you.
Thank you very much indeed, Justine Namuli. And that will be our last leader that we'll hear in today's Leaders and Partners Forum. I do want to say we have much more ambitious plans. We were overwhelmed, and I think Maria in particular, because she was trying to keep up with all of you. It's been absolutely amazing seeing the level of response and interest, and we have much bigger plans for Teach to Reach 11. Check your inboxes if you're a local partner, if you're a leader in a local organization, wherever you may are from any country. We'll be inviting you, and next time we'll be doing a lot more now that we have gotten to know you and you've gotten to know us and understand what this Teach to Reach family, and we hope that you'll get a lot out of today's sessions for yourself, for your organization, and for the communities that you serve. Once again, thank you.